Hi, welcome back to Balance with Bailey, your wellness brand and podcast where we are figuring out how to balance it all together.
Together.
Today, I'm so giggly and so excited. Miss Hayes here, Miss Hailee Shelley.
Hailee Shelley knew it.
I know! I guess we never had the same last name, but it's a new last name.
We're cousins.
If
you didn't know.
Now that your hair's brown, I feel like we look a lot more alike.
A little more similar for sure.
Yeah. So, for the people who don't know you, give a little background. Give a little spiel.
Hey, it's Nurse Hay. That's how I start my videos. But I'm a nurse injector. I just got married. I live in Utah. I've been there my whole life since Bailey moved out. Still going strong in Utah. I'm LDS. I love Pilates. I don't know. I'm stepping into my Pilates wellness journey like Bailey has been. A couple steps behind, but I love
Nurse girly. Nurse wellness girly.
Yes.
Yeah.
Dipping my toe out of wellness. I've just been poking people. But now I'm wait, maybe we should do a vitamin shot here and there. So I've been doing that. But yeah, it's so fun. I'm happy. We're excited to be filming.
Yes, so excited. So both of us, we're both nurses. We actually have a lot of nurses in our family.
We do.
Which
my
is something.
My mom's a nurse. My grandma was a medical. What was she?
She was basically scrub tech MA
at a plastic surgeon's office for I think majority of her career. Almost 30 years, I think. Yeah, I don't think she stopped working till she's older, honestly. So yeah, we have a lot of medical vibes going on. And
we're all now outpatient.
Yes, we do not work the
floor. No, we are not hospital girlie's. And you know what? No, it's okay to not be a hospital nurse girly.
It really is. And that's the thing too, is when we didn't get burnt out of the hospital. You had a year or two to get burnt out, and you're like, get me out of here.
Yeah, it really wasn't that long compared to everyone else, and how some of the nurses have been there, and I'm just like, you know what? It's hard to, I think it's almost harder to be in a hospital situation and step out of it and leave it and be like, oh, everyone thinks you're going into not real nursing, or you're taking the easy way out and all this stuff. I feel like that's almost harder sometimes than just starting outpatient and being like, this is all I know.
Yeah.
But then again, that's the beautiful thing about nursing is you can literally do whatever you want whenever you want. So,
and I think there's respect on both sides. I live, laugh, love my soft nursing girly pop. I'm a nurse injector, so I have fun all day, right? Is what they think. But I respect everyone that works in the hospital. I'm I need you in the ER because if my husband got hurt, I need someone, we need those kind of nurses. And I think having a mutual respect of one is not better than the other. There's glamorous, and then there's also the cons of both. You know what I mean? There is both.
And I feel like nursing and working in healthcare in general is so glamorized. I feel really until the pit came out and people were like, wait, this is what you go through. It was low key on a certain level. Yeah.
Even just through COVID, it started to show how bad nurses had it.
Everyone was like, oh, I want to be a nurse. And I was like, no, this actually sucks sometimes. And it's not that fun.
If you go to work, someone might die. That's a pretty big concept to think about. If you are a realtor, or you're just imagine someone dying at the house.
No, and it's that could happen to any kind of nursing anytime, anywhere.
Oh, I could have the same situation. I could have something crazy happen.
Yeah, you never know.
You never know.
But at least we're not in the hospital.
But thank the Lord above.
At least we're not in the hospital.
No, genuinely. Yeah.
So how long before you were an aesthetic injector did you know that's what you wanted to do? I know there's a whole backstory of you being in the beauty space for basically your whole life. I remember when we were little, she gave me my first haircut. I'm pretty sure
we were doing makeup.
We were out there doing makeup, stealing my sister's makeup and just doing makeovers and all the girly things. So how did you know that kind of pipeline?
Yeah, I always knew that was the vibe for me. I always, girly pop, it's Hay. But graduating high school, my mom was like, you should do esthetician school. And I was like, okay, in my senior year. So I did it with some friends. I didn't think this isn't going to be my career or whatever. It's just a good certification with my CNA to get, just in case I want to do nursing, because my mom's a nurse. So I was like, okay, grew up dancing my whole life. So I knew I wanted to go to college, get something higher up after my esthetician.
Dance in college.
I ended up doing 2 years at Utah State and had so much fun. And through all that, I was like, okay, yeah, pre-nursing, I'll just kind of do that while I do dance. And then I did all the pre-stuff, and I was like, oh, it's Kayla.
Oh, you're like, oh, wait, no, I actually have to do the nurse part.
Yeah, and so then I applied to Weber because I was going to apply everywhere, but if you apply to Weber and you don't get in the first time, you get a point. And so I did Weber summer thinking I probably won't get in, and then I'll just go in the fall. Ended up getting in. I was like, oh, okay, I guess I'm going to Weberg. And then that meant I moved home. So I was like a little bit stressed about dating and life and, you know, whatever. Just moving home after being away for 2 years.
Yeah.
It's a lot.
Different. It's like kind of rough. Like, I feel like COVID, I went through that because I had my freshman year at college. And then I was with everyone for COVID. And I was like, wait, guys, this is like
too much.
Kind of crazy. Like, I got to go back to Idaho. I'm sorry.
Mm-hmm. So I was like stressed about that. But I think the one thing that got me through nursing school is knowing, okay, like I'm doing all this so I can better like my knowledge with beauty. Because while I was doing nursing school, I was working as an esthetician. Yeah. So like I constantly was with patients, clients all single day, like every single day, not working a CNA. That was my job outside of nursing while I was in nursing school. So I knew like that was always the goal. And the amount of crap I got from it in nursing school.
Oh, I'm sure.
You know when you go to clinical and then you probably said, I want to be in the NICU or the PICU. Like, yeah. Oh, so you just think you're better. Like,
yeah, like you just want to work with kids. Everyone says they want to work with peds.
There is nothing worse than when my preceptor would be like, so where, like what hospital unit do you want to be on? I'm like, aesthetics. They'd be like, oh, so like you're not going to do nursing. And I'm like, yes, I am.
You're like, I'm still doing procedures.
I'm like,
I'm
drawing up lidocaine every single day. Like, what? I don't know. I just knew that I had to push through nursing school because that was always going to be the goal. Like as soon as I wasn't going to nursing school to figure out what field, I already knew what that was going to be the build on top of my esthetician license. And I think that was definitely something that helped me get through it and not care what the haters said, because I was like, I'm not here to be in the ER. Like, yeah, when I was floated on the ER, I was like,
I know my lane. I know my role. I would like my nails done. Right. And I want to wear makeup to work and look cute.
Yeah, like no. Well, did you know, like, because you wanted to do something with kids, and then you decided it's too much.
Yeah. So because I went into nursing school, like
you can handle it. I'm like, you can handle anything.
I went in going like, I want to be a trauma nurse, all this stuff, and then I got my CNA, worked in trauma during COVID, and was like, absolutely not, that's too much. Right. And then I was like, wait, I have OCD and like love kids, so it was like perfect, pick you. It fell into my lap. I was the only new grad who got hired, so I was like, oh, awesome. It's a sign. Like whatever. Did my 2 years, but then I was like, I need time before I have my own kids, and like I want to have kids and be a young mom. So I was like, I need time to like unsee all this, or else I'm gonna like bubble wrap my child every day and make them wear a helmet walking outside.
They're not
like,
allowed to do anything.
You can't eat popcorn. You're not allowed to be outside when the weather's raining, like things like that, where I was like, okay, I need to like desensitize from it. And I was working night shift fully, and I was like, I actually hate my life. My body hates me. I'm not sleeping.
I can't even imagine trying to flip back and forth. Like, again, props to anyone that's doing it. Like,
and doing social media and stuff and coaching and like all my fitness things on the outside. I like literally was not sleeping, and I was making more money not working night shift. So I was like, something's got to change.
You're like, this is running me ragged.
Yeah. And then our grandma worked in plastic surgery and like loved it. And so I randomly applied to this job, not thinking they'd hire me because I have kids experience. The only time I've been in an OR was like donor cases, and I'm just watching. I'm not doing anything. Yeah. So I show up to the OR the first day, and they're like, what do you know? And I'm like, absolutely nothing, which is also so humbling. Like, no matter when in your nursing career, if you switch departments or switch
you're gonna be dropped on the bottom floor again.
Oh, like I went from being like a very confident ICU nurse.
Well, because you built your knowledge, and then it's like,
and then in the OR, I'm like, what is a Bovie pad?
Yeah. Like, well, that's how even I felt, because I did my capstone in nursing school like the last semester is you're with the preceptor for one rotation, and that was mine too. And so I even was like going into nursing school, all of that stuff, then getting to that, I was like, wait, they didn't teach us anything about the OR. They teach you nothing about the OR. I was like telling my nurse, I was like, I actually like this better than nursing school.
It's amazing.
I was like, this is better than this. I didn't even know this was like a kind of nursing I could do.
Yeah, and it's
I thought it was
so
just like
different.
Cleaning trachs.
Like, when was the last time I checked a vital sign? Good question. Yeah. No idea.
I just remember like going to like the patients were like the trachs and they're on ventilators, and I was just like, this is so sad and gross. And
and that's why I got to the point where I was like, I have to do something else. And then of course I was like, oh, Nana liked it. I'll try OR. Yeah. And now I'm like, I'm never leaving, and I absolutely love where I'm at. So
well, and there's pros and cons. Like, I guess we can kind of move towards that conversation of like, what are the pros and cons of working in and out, like patient? Like, it's because it is like hospital, because you're still in the hospital, but it is is so different than the floor. Like maybe
It's
they
so
don't
different.
understand like what.
Yeah.
Like how I don't know.
So like in the OR, how it is just so different is like just the flow of things and your patients and who you're working with. Like instead of doing a lot of bedside, like talking with the family, explaining what's going on, talking to the patient, talking to the kid.
Education.
Yeah. I bring my patient back, intubate immediately.
They're like,
prep.
good night.
Yeah. I'm like, good night, intubate. I prep the patient, like that's my role.
And
as
they
an
already
OR
have
nurse.
their IV in.
Yeah,
It's
they already have the IV.
Yeah.
Unless they're kids. If we do tonsils and stuff, I do the IV in the back, which like I eat up a peds IV. Let's be so real. Like 22 in a little chunk, like easy.
Yep.
But then put them to sleep.
Right.
Prep the patient, get them situated. I do the timeout, so we go over all the details, the patient, like so everyone's on the same page. Surgery starts. I plug stuff in, move things around, and then I count, so I make sure we don't lose sutures or anything like that.
That stressed me out too. And they're like, Hailee, do the count. And I was like,
oh, one time we had a count and the suture count was off because
oh my gosh.
I can't. I think it was my fault. Honestly, I think I added the numbers wrong.
That is like the biggest nightmare of like every
nurse.
nurse.
And we had too many sutures, and I was like, wait, so this isn't the problem if there's too many. It's not like we're losing one. I'm like, she counted 35 and we were supposed to have 34, and I'm like, oh, so it's not that big of a deal, but like I just literally didn't count right. But so I do the counts, that kind of stuff, help the scrub techs grab stuff, don't know what they're talking about half the time. They're like, can you go grab this? I'm like, no idea what that is. Okay.
Or they'll say like, go grab the suture 731, and it's like
on a PS2,
and then
like,
it's like a wall of them, and you're like, oh my gosh, and like the longer you take, the longer they don't sew the patient.
Oh, and they're just sitting there like this, and you walk back in the OR and they're like this.
And you're like, you literally couldn't do your next step without me.
I just grab the box and like any options. I'm like, this one, maybe. Yes. Okay.
You're
cool,
kind
cool.
of like the eyes, ears, hands, mouth. Like you're the one that can like, because you're not scrubbed in.
Yeah.
So she can do like everything that's like needs to be handled. That's not touching the sterile patient.
Also, if something's broken, it's my fault.
Yeah.
Like
immediately your fault.
If the camera and light aren't working, Bailey, like I'm now a technician.
Yeah,
like I'm a striker rep.
Now you have to go find. Yeah. Now you have to go find the rep.
I'm like texting the rep. I'm like, hey girl.
Why is the light not working? It's blinking at me. Like, don't unplug it. You're like, well, I do it.
No, it can. Honestly, majority of the time it's super chill, but it can be so stressful. But then, anyways, so usually do all that stuff. Then I call closing. Extubate the patient, take him to PACU, and I'm like later. Yeah. But it can be so stressful sometimes, especially like surgeons are known for being a little spicy.
They're being so rude for no freaking reason. Like,
or if something's broken or we don't have an instrument, like it's my fault, and I'm like, okay, whatever. Or if someone's in a bad mood, you're
like
just
they just kind of take it out on the nurse.
And I'm also a DJ, so I also have to be taking account the vibes of the room.
Yeah, they have to play the music, and surgeons will want like classical or they want rap. Like there's no in between.
Yeah, like it's like Tiesto at 7 a.m. And I'm like, why am I in Ibiza?
Yes. And not to mention, they are all very OCD, and like every like doctor wants the setup of the room different. Like,
or
and you have to remember
written down differently. If you do lipo, I want it written down this way. I want this set up that way.
It's a lot.
For every surgery, it's different. For every surgeon, it's different. So I bounce back and forth between ENT and plastics. Right. So it differs so much each case. Like, thank God we have preference cards, or else I would be so lost.
And again, who taught us that in nursing school?
No one.
There was not even, I don't even think I covered a section on the OR.
No, I don't think so either.
They
just said pre and post.
Yeah, they're like, just make sure, It was all
anyways, but that's usually my like day to day.
But pros of yours is like you have pretty good hours because they don't work holidays usually if you're like at a good facility that's like smaller, like, you know, just doing like ortho or whatever you guys do, plastics. It's like 9, what do you do? Start 6 to
it's like I get to the OR at 6:20 and set up because I'm OCD and I like my OR ready. Like I like my OR ready before anyone gets there. So I get there at 6:20, and then once my patient wakes up, I can leave. So if the other OR is still going, I get to leave. If I'm the last one, I help clean up. Yeah. And then it's like my patient leaves, I get to go. Like honestly, I usually leave around 3. I rarely stay till 5, which is
6 to 3,
amazing.
6 to 5, like
compared to a 12-hour shift, compared to a 12-hour night shift, I'm like, this is nothing. Every time I'm driving to work and I'm tired, I'm like, girl, you used to stay up all night, chill. Like, you're fine.
No, that's how I even felt during my clinicals, because like everyone would be like complaining. I was like, I'm doing fine. Like I see the sun and I see the sunset. Like sometimes the other hospital, like when I was in clinicals before, I was like, it's so depressing when you have to get there at 5 and it's daylight savings and you get done at 5 and it's pitch black and you're like, what is life? Like that's the worst.
Totally.
Oh, that is the worst. Not seeing the sun just is like a immediate mood depressor.
No, for real. And then it's summer and you're like, I'm alive again.
Right. That I'm like, no, I think you definitely have some pros of scheduling.
Yes.
Versus hospital.
Honestly, there's more pros than more cons for sure for me. But I'm assuming for you too.
But like, what would be a con? Like, what is like your biggest con then?
My biggest con? I genuinely cannot think of one. Like, I love
Love that for her.
No, like, I love everyone that I work with. Like, we work so good in a team effort. Maybe you're stuck in the OR with 5 people for 9-hour surgeries, and like, if you don't get along, I see how that could suck. Or like, if someone is having a bad day, like,
Or just a stressful case in general.
yeah, or like a stressful case, like we had a cochlear implant where it was like, if we don't implant this today, which they got the cochlear implant, what's it called? Like gifted to them for this. So it was free. So it was like
They
one of
had
those
to
pro
use it.
bono cases. They had to use it.
Yeah.
She would lose her hearing if we didn't insert it that day, that time. The rep was there. They had
Just
like
a
a
lot.
national
Pressure.
rep. Yeah, because they were like making a story on this of like what the company and brand were doing. So it was like a whole thing. There was like an article written. So we're like, oh, this really has to work.
Yeah.
And it was with our OCD doctor, but it worked and it went great, thank God. But like at the beginning of the case, once we got like the hearing back and we're testing it, the rep looked at me and was like, thank God. And I was like,
you're like, thank you.
yeah, girl, that could have been rough. So
It
like,
definitely is high stress.
Yeah, there's definitely stress.
It is definitely it can be a high stress.
Totally.
Yeah.
But I think I'm also just like so numb from the high stress of PICU.
You're like, it's fine.
And like coding a child at 3 a.m. So I'm like, this is nothing. I'm like, I'm loving this.
Yeah. My NP is a neuro. She's on the neuro unit, also in Utah. And so she is always like the doctor on call through the nights, and like the stories she tells me, and I always tell her, I'm like, yeah, I was not meant to be there. She's like, yeah, hey, I don't know what.
No,
she's like, it's a good thing I found you.
People are like, oh, do you want to be an MP? Do you want to be a CRNA? Like, do you want to go into anesthesia? I want less responsibility. I don't. That's why I'm
stress me out.
outpatient. I don't want more responsibility. I don't want to go back to school.
No, thank you.
All props to the people who do, but like, it's so okay to not want to go back to school too.
Yeah. Well, can we even talk about like in Utah, I don't know how it is in Idaho, but in Utah, they actually cut down applicants to all nursing schools because when I finished, it took me almost 4 months to finally find my job. And I don't know if you guys know, like Kennedy Powers, like, you know, the blondie baddie. She just barely got a nursing job. We graduated the same time.
That's so crazy.
The schools actually have taken back less applications because the nursing field got too saturated after COVID. This is my personal opinion. After COVID, they realized they can function on low staffing. Yeah. So then they stopped hiring as much.
And no one
it's really hard to get a job.
That was totally
really
here too. And the thing is, no one wanted to hire new grads specifically. And it's like, you have all these new grads.
Like, what's your experience?
What's your 2 years experience? How are these people supposed to have experience?
You can do our preceptorship and pay. I'm like, what?
That's why they cut.
Did nursing school.
That's why I was the last one to be in the PICU because they cut all new grads after me.
Oh my gosh.
And I'm like, again, we're in Idaho. We have 2 hospitals.
Right.
We're the only children's hospital. How are we low staffed when we're the only pediatric trauma team in the entire state?
Yeah. I think one of the biggest questions I get asked like on my socials is like, how did I get my nursing job? Because in Utah there's a med spa on every corner in every street. Everyone wants to be pretty, and it's very oversaturated because everyone wants to work in it. So like when I graduated, I like started applying. I was like, I just need a job. Like I was about to get married. I was like, I can work in the hospital, like, and then this could be my dream at some point. I literally applied to over 30 things on Indeed. I'm not even kidding you. Didn't get one back. I wrote cover letters. I was like, why? None of my friends were getting jobs. We were all like, what are we doing wrong? And then by the grace of the Lord above, I found Gemini Glow. My baddie's over there. Like I love my nurse practitioner. Fabi's amazing. Like a lot of the times with like nurse injecting, they're the same. Like, we want you to have experience. It's like, well, how am I going to do that? The courses in Utah, like you can go and pay $5,000 to learn how to do Botox and fillers, and you didn't even scratch the surface. Yeah. And then like you take that to your application, then they look at it like, so like, have you ever done this, this, and this? And you're like, break. Yeah. But honestly, like my NP, she just was like, I see your potential. And that's like my biggest like advice for anyone that wants to get into nursing, injecting, is build a social media. Like, even if you're not, I had an aesthetics page, so like I could be like, look, I'm really good at this. This is how I'm different than all your other 30 applications. Because even my boss told me, she's like, I literally would submit that, and then I had like 40 people apply. Yeah. And so she was like, the only reason I saw you too is because you showed me you knew how to do content. Yeah. This is the biggest part, is why are you different? How can you be different? And the thing is the ER, the door is revolving, right? There will always be clients, patients, whatever. My door is like shut unless I open it and like tell you to come in and why you need to come in. And so that is a huge thing, is the social media part of injecting, is you need to have an online presence, because that's majority of my clients, and all from social media.
Yeah, and you also already have a huge following from dance, and like you've been doing that, building yourself up on socials and stuff for years, and that shows. And so you're like, oh, now I can just like tweak it to my advantage and be like, okay, here's
now I can have an online presence in this way. And that was different too, because I was like, wait, now everything I post, people are seeing as a professional standpoint, like, oh, this is Hailee, my nurse. So then I was always like, a little bit at first, I was like, wait, I probably can't post that because I don't want to like seem unprofessional, but like I want to show I'm fun.
Yeah, and like show your personality, right? But at the same time,
and you probably have the same thing too. Like I'm a nurse, or you teach Pilates, so it's like you don't want them to be like, what the heck?
I'm posting like videos of me like working out in my sports bra and shorts, but then like the next reel is like me in my OR scrubs, and I'm like,
and it's even as simple as like, imagine if you posted something like controversial about religion, or like about like politics, like, and you're their nurse, and then they knew your standpoint, and then they're like, I don't want her to treat me. Exactly. Or even me, it's like if I shared like too much about my personal like opinions, it's always it's a factor. Some people won't go to some people because of religion or politics, sadly, and it's like, I don't know. It's just different.
And I think the world, like, I think just like culture and society in general is coming more to a point of like, okay, like speak what you want, whatever. And like, if you don't want to come to me because of my thoughts on something, okay, that's like not even personal. That's a you thing. That's not a me thing.
Okay.
That's a you thing. And like, I'll figure it out. I'll be fine. But I think there has been a lot of stigma about that. And I feel like I feel like it's getting a little better, at least here. Yeah. I don't know about Utah.
No, yeah. I mean, I just try not to talk about it. Like, if I'm like with my clients, I'm not going to talk about it.
Oh, yeah. Unless someone asks you about something, you're like, okay.
Yeah. But I guess back to just how to be nurse injector, because I just feel like everyone wants to know, is you need to just train. Like, my MP just took me under her wing. We walked through everything. Like, I didn't take clients independently for almost like 3 months, I think. Every time I did someone, she was in the room watching, making sure, and she trusts me. Like, she's honestly like put a lot of trust in me, but I think it helped me put on like my big girl pants. And like, I remember I was going to do some chin filler, and that's a little bit scary because there's an artery that runs right through your skull right here that connects to your whole face. And if you put filler in it and cause like a blockage or occlusion, you can like kill their tongue. You can make them go blind. There's a lot in the chin. Like, there really is. And this is why I'm like, I know what I'm talking about. I'm a smart nurse, even though I'm not in the ER. Anyways, that's a whole nother thing. But I'm just saying, what she made me do is I was like, oh, I have like a chin on my schedule. And she's like, you've done them like countless times. I've watched you. You're fine. And I was like, okay, can you just come in early? Because she usually does the nights and then comes. And I was like, can you come like 30 minutes early and just watch me? She was, I'm so sorry. Hey, like, I can't, like, I'm running late. And I was like, okay. Did the chin. It looked perfect. I was fine. I aspirated. I didn't see any flashback. I was fine. It was safe. And then she comes in and she's like, I was just waiting in my car. Fabby, like, what?
I love that. That's so
like,
iconic.
I knew you could do it.
She's like, girl, I was here the whole time. Don't play.
Because it is stressful.
Oh, yeah.
When you're dealing, and that's another thing, is like about versus ER and stuff like that. It's like, I'm working with hard patients because they're coming to me for
wanting perfection.
Yes, like to make me feel less insecure, basically. Yeah. And that's a very, very, I'm like, let me see what I can do, queen. Because there's like the talks of like, you know, we're going to work with what you already got, but like, let's enhance and let's tweak. But, and then it is a medical procedure at the end of the day, and there can be complications, and it is, I need to know these arteries. I need to know the muscles. I need to know.
That's why you can't just go to random people who are putting out a sale every month or every other thing. And it's like, no, this is like, there's so much knowledge.
Your face. Like, invest in it. Like, it's your face.
Even just like, learning how to do Botox, because I can do Botox. Yeah. And even just learning all of that, it's so deep. Like, it literally took me 3 days of 8-hour training just to learn Botox, let alone filler scares the crap out of me.
It probably was just the basics too. It's not even like, okay, and you learn so much even on the job. Like, if you make an eyebrow wonk, you're like, how do I fix that? Like, and luckily I have my MP to help, but it's like,
no, it's so much deeper than people think. They just hear the word aesthetics and think spa and think it's like something so chill, but like,
it's not.
The pros and cons of your job and what you do.
I've never had an allergic reaction, but I do know someone in the field that has had a patient go into full shock after she poked her with one thing of the Botox, like 2 units in her forehead, full on like anaphylactic shock. Had to call it they had an EpiPen her, like they had to get, like it was a whole
please may that never find me.
No, literally, I'm like, this is a serious like what are you gonna do in that situation? Like I need to be prepared, and it was almost a check for me. I was like, what do I do? Like I gotta learn post care or like learn what happens if it's emergency, because it can happen.
And
it
also
really
when there's an emergency in the hospital, you have a whole response team that's going to come help you. If you have an emergency in the OR, if you have an emergency in your client, like your client's in your chair, it's literally just you. And it's like,
obviously I have my NP on the way, but like still, and it's like,
she's also tiny. What's she gonna do?
Gotta figure it out too. Like we gotta figure it out together. But like that's also a pro. I guess that's a pro of the OR, is I always felt safe as a nurse in there because you have your anesthesiologist, doctor, like everyone is there, and it's not just on you.
I'm the least smart in the most respectful way. Like of stressful things, like I'm the least smart one there, and I'm so okay with that.
Yeah,
like,
no, I loved that feeling.
I'm like, tell me what to do. I'll do anything. Like I'll do compressions. I'll like
give me
tell me
direction.
to intubate. I'll do it. But like, if I have someone telling me, great. Like I just don't want to be the one making that choice.
Right. No, 100%. It's crazy. My normal day to day is, I love my hours. Don't laugh at them.
You literally get to pick them. Like
I'm like, I get to pick them. No, they're Wednesday and Friday usually. Again, if my husband's gone for golf and I really want to go, then I can rearrange my clients to another day. My boss is pretty good if I want to work like the Thursday instead, but I'm usually there 9 to 5. Or 9 to 4 on Fridays is kind of, I like to get out a little earlier.
Yeah.
But I'm like, why not?
Yeah.
But yeah, 9 to 4. I do take a 30-minute lunch. But yeah, my patients are pretty much lip filler and Botox all day, every day. I'm kind of the lip queen is what I've decided on my own title. A lot of girls come to me for lip filler. I specialize in natural results. I don't like to make them look huge, and I mean, I'll do it, but I don't like to post it as much because I want to attract girlies. A lot of my girls are 18 to 30 getting more natural results, and then anyone up there is usually doing Botox, and then we can do filler obviously for like more facial reconstructive things. But yeah, so I always get there. I try to get there only like 15 minutes before. I just go to the back, I drop my Botox,
mix your stuff.
I mix up my goods, and then I open up the shop. Usually it's me and like our front desk girl to start because my boss comes in later. But I just treat patient like almost it takes me like, it takes me a little longer, honestly, like 45 minutes, 40 with a lip patient, because this is like someone that I'm also building a connection with. Like I love to talk to my girlies. We kind of assess everything while their lips are numbing. The actual injection part takes like less than 10 minutes. Like if I just get in there and go, but then also you have to account for some people like really can't tolerate pain. Yeah. And so like they might need breaks, you know? So time. It's hard to know exactly when I'll be done. So I always just do like a 40-minute block. And if I go over, it's fine. Or if I get under, it's fine. But yeah, I go through, a lot of my clients come from social media, pretty much. I would say 80%. And then the 20% is referrals from the people that come to me. I was pretty fortunate when I first started because my boss let me do a promo and it blew up on TikTok. Nice. And so I had a full door, like
straight out the gate.
I'm going to be honest, like since then, like it has been great. And granted, I work 2 days a week, but like I make the same as if I worked 4/12s. Like exactly. It really, like, yes, I only work twice a week, but that is great because I am
when the appointments aren't that long too, you can back to back. You can
I'll schedule like 4 full girls day. In an hour Botox, and each one is like $500 to $600. Like it really starts to add up. But that is the one thing is people don't understand about my field is my work doesn't really stop because I go home and I have to edit videos. I have to do education videos. The amount of DMs I get, I'm like, just click the link and book. Like, oh my gosh. Book the consultation if you don't know what you want. But I mean, I'm happy to answer, but then people will be like, how much filler do you recommend? I'm like, I don't know until you come in.
Yeah, I don't know when I don't see
Tyson, like, no, my husband, he knows like when I'm like
overstimulated.
When I'm doing client stuff at home, like I'll get home and like, just give me a second. And then I always voice text. I'm like, hey girl, so it's $375 for a half and it's $650 for a full. He like knows the prices because I say it all the time.
He's like, I'll just start voice texting. I'm
like, just click the link. It's on there. It's on the, but I get it. Like when you're scrolling on TikTok, you're like, how much? Like, you know, where's your top from? You know, like I get it. It's
send the link. Send the link again. even though the link is in bio, said it. Right. Yeah. But that's also something about social media, and like that whole aspect of it is people are like, don't think about it, but you're so much time and effort goes into every single thing that you do. And like,
I know.
it could blow up and be the best thing ever, or it's going to flop and like 5 people are going to see it and you're going to be like, I just spent so much time doing that, or like responding to DMs. Those relationships that you build with people are still building relationships. It's still that same like trust
because they're gonna be my client maybe if they like me.
Building it, versus like in real life, it's the same thing, and it's like it's so much more overstimulating than people realize.
And that's the thing is work never stops. Like
never.
I mean, you've seen me this weekend. It's like they just start texting me, and I'm just like, it's a Sunday. Like, it's literally Sunday. Yeah. And I'm the worst about this. I mean, it's great for my clients, but I'm the worst of, I give my phone number out because if there's ever a complication when they leave.
You want to know.
I want to know because they need to come in within the hour. So I've had a girl, like, DM me before, like, hey, is this normal? And it's like, I didn't see it for like 5 hours and I felt so bad. Like, she was totally fine.
Yeah. But like,
it didn't need anything. But it got lost. So I usually give out my number, but then I get texts. I just don't respond until Monday usually. Or Friday afternoon, I'm like, I'm not going to respond.
Yeah.
I just have to for my own mental.
No, literally setting those boundaries and being able to
like I can't.
have a moment. Have you had any complications or like what ifs? Like,
I've had one
because it's never in your control.
No. I've had one girl and she's a doll, and if she watches this, she'll know. She's okay if I mean, she was like totally fine. We like took videos of everything to like educate, whatever. But we did her filler. It was only a half syringe, which is very not low risk. Like
that's not that much.
No, like you're not gonna have a vascular occlusion very rarely. So she sent me a video, and luckily she had my phone number, but I live an hour away. I live in Provo, so I got to drive up. And she sent me a video of like her pressing on her lip, and the capillary refill was really slow. So like it was pale, and it took really long for the blood to come back, meaning something might be blocking her blood flow.
Yeah.
This is like, you gotta come in for this. Like, this is not this is like code red. Like, this is like,
you're like, this could be really bad if.
And I'm not trying to stress her out. And I just gave her a call and I said, hey, like FaceTime me. And then she would do it. And I was like, okay, let's go in. And she's like, am I okay? Like, yes, but we just probably need to dissolve a little bit. We had her massage it, and then when she got there, my NP met me there because I was like, girl, get in here. You're coming here with me. This is not like I need your help. But we massaged it super, super hard, and it was crazy. It like, sorry not to be graphic, it like spread out like a whole thing of blood. Luckily, it was not filler. It was like not a blood clot, but inside bruising is technically just blood filling and then like trying to clot itself. So we were able to massage, and it brought back all the flow of the like her refill got better. It was.
Did you dissolve any of the
filler? Did not dissolve anything.
Wow.
So we just needed to massage, and then we obviously monitor through the night, through the morning. I text her the next 3 days. But my heart, like, genuinely
sank.
I was just with Tyson in the kitchen about to make dinner, and he's like, what? And I was like, no. Like, this is the time it's happening, because they always say it's going to.
It's not if and when. It's when.
It is when. Like, and that was like, I was like, crap, it's now.
Yeah, you're like, okay, wasn't ready. It's never when you expect it.
No, and it's hard to tell the patient too, like, you're okay, but also I'm like, I gotta get in here and do my
nurse
thing.
Hey kicking in.
Yeah, I'm like, this is not a like, but I don't want to stress her out.
Yeah,
you know what I mean?
Yeah.
But if you're out there and you're like thinking about cosmetic stuff, it's like there is a risk.
It's still a procedure.
You are adding a foreign substance into your body that's not technically supposed to be there.
Yeah.
All filler is hyaluronic acid, just a PSA. Your body makes that naturally. No one should be allergic to filler. Just some education, but still, you can cause the vascular occlusion, and it's scary.
And that's why it's so important to know who you're going to.
It
and not
really
doing random people's sales.
I have girls that will tell me they followed me for over a year or like 6 months, or like, I finally just booked it because, and I love those kind of patients. I'm glad I finally got you in here, but I'm like, that's good that she actually cared about her face. It wasn't just like, but then I also, my clients, I get a text on my phone that's connected to like my linking, like my booking, and it will say the time that they book. And like, I love my girls when it's 11:53. If they see I have an opening, I'm like, slay.
You're like, yes.
It'll be like lip filler, full syringe. I'm like, she did an impulse.
Yeah, impulse.
But I'm like,
middle
she's in
of
good
the
hands.
night.
She's okay. It's fine. But no, it's a whole nother world.
No, for real. So majority of your clients are females.
I've had some guys.
Have you had some
90%?
I feel like because I feel like guys getting Botox is kind of getting more popular. Like,
yes, I'll do the talks. They're fine. I mean, they're usually boyfriends, girlfriends.
Yeah,
like the girlfriends, like they need to come, or just honestly guys that like start to get older, or they've already been doing it.
Yeah.
I have had some guys get filler.
Love.
Like, bless this cute guy's heart. Like, I opened the door one day and his name was like, could be a girl or boy's name.
Yeah.
I was like, oh, are you my first? He's like, yep. And I was like, all right, let's do it. I like was not expecting a guy to like, like when I opened the door, but no, he was awesome. We just filled his lips. He like recently got out of a relationship and he's like, this is for me. I was like,
yeah, he's like, why not? Like,
I'm like, this is for you, King. Like,
there's nothing like a pickup after a breakup, like scooping yourself
I'm just
up.
like, yes, like you deserve that. And he's like, yeah, I always just been insecure about it. I'm like, well, then let's do it. Yeah. That is one thing about my job that is so rewarding is like when someone comes to me with like a huge insecurity, like, again, okay, not to get like drama, like, I don't want to cry, but like that for me, like I didn't smile with my teeth from 16 to 21.
Yeah.
I didn't like my lips. I did not like that it disappeared when I smiled. And when I first got lip filler, like, oh my gosh, that feeling was so like, it was just relieving because I was on the dance team and I started smiling with my teeth and my coaches were like, Hailee, like we love this performance. And
your energy.
They had no idea that it was just because I was insecure. And it's crazy that I was hiding a natural emotion because I was worried about what I looked like being happy.
Yeah.
And like that, I'm like, I get emotional about it because truly that's why I wanted to do this, because it can affect you. Like your face, the way you present yourself, like it's hard to perform. Like it's hard to go to your work and not feel confident, or like go on a dating something. Like it's hard if you don't feel good. And that was definitely a reason why I was like confirming to myself, like, yeah, I want to make girls feel like that. And I've had countless girls like cry in my chair, like if I show them their mirror and they like literally look at me and they're like, thank you. Gosh. Like it's so tender. Like
so cute.
My cute girls that cry, I'm like, I get it.
Yeah.
Or like sometimes like my girls will send me a message like 2 weeks later when they're fully healed, and like I've had so many messages, I'll screenshot all of them because it makes me like I'll read them out loud to Tyson, and I'm just like, I made her feel like that, and she's like posting all these selfies now, and he's like, that's awesome. Hey, and it's like, it is so rewarding. Like I'm not saving a life, but in a way I'm like giving a girl confidence
in your own way.
Like, I'm giving her confidence to go on the date, to go get the job interview, to go do whatever, and it is truly so special to see. Like,
and like
it's
as
rewarding.
As big of a deal, like from a nurse point, like yes, it is a medical procedure. Yes, there's all this stuff. On the other side of it, like since getting Botox in my forehead, love. Like,
oh my gosh,
little things like that. Where
can't go without.
It's really not that big of a deal. At the same time, like once you start getting it, or like everyone's so scared to get the lip filler at first, and then you do it one time, and then you're like, girl, I'm thriving, and it was not that bad.
Or like I'll have people send me photos like, this is from last weekend at my sister's wedding. Like I will look at old photos and I'm like, what was I doing before?
No, literally.
Like, the confidence, again, like just smiling in family photos, smiling before your wedding.
And like you can always get it dissolved. You can always wait your 3 to 6 months, and your tox is gonna chill out anyways. Like
honestly, try everything once.
Yeah.
Like, I'm like, we could walk through what I've gotten done, but like try everything once. Like,
yeah, well, why not?
It's have you just gotten Botox and filler?
Yeah.
I'm like,
yeah, so I've had
that? I'm like,
yeah, of course.
I'm like, I'm very open.
Girl, I inject myself. Like,
no, me too.
I've like fully forehead better be frozen. So
we're doing that together.
Botox in my forehead and my 11s, obviously.
And how many do you do? 15? 20?
Yeah, 15.
15, and then how much do you do forehead?
Usually like 10.
Same.
Yeah. 10, sometimes 15. Sometimes I do a little more because I got really hard 11s.
Right.
But also, it's been like 2 months.
Do you do a brow lift?
Oh, always.
Same.
Yeah, girl. We got those Pfizer hooded eyes.
How many units do you do?
2.
I do 4.
I should, honestly.
I like to feel it.
That's like, no, for
get up
real.
there. Do you do a lip flip ever?
No.
Those hurt
Those scare me because I know they hurt so bad. So I can't. I do my DAOs.
Me too.
Because I have naturally down.
So do I. I love the DAOs. I haven't ever done masseter.
I haven't either.
Yeah.
I love everyone.
And then you have half or a full cert? Sorry, I just told you.
Full. I did half and then did another half because I got scared. But so full. But everyone who I've done masseters loves.
They love it.
I've never had anyone complain. I've never had anyone not enjoy it.
Are you doing like 20 to 25 then?
Yeah. Yep. And just like on the sides, and everyone loves it. And it's usually the girls who cleanse their jaw, TMJ, all of that, and just slim their face.
It's so good.
Like my best friend, I did hers, and she's like, "You literally have to do this." I'm like, I can't do it that frequently, especially in those muscles. But
it's a little expensive too.
It's expensive, but it makes such a difference that you don't even realize. I'm like,
So then you did your half and then your full.
Mm-hmm.
Right.
Yeah.
So that's what you have done. That's everything you have done.
Yeah.
I'm like,
Your turn.
I have a little more. Okay, so 15, 10,
Yeah.
4 and 4,
Mm-hmm.
3. Sometimes here I do like 3.
Yeah.
I usually do a lip flip, and that's like 6 to 8 units. I like to go 8 because it's a little drama and it lasts a little longer.
Of course.
But that's on my talks. I don't usually do my crows yet. I've done stem cells under my eyes. I have naturally really deep circles from my Andrew side, and then the discoloration too. The stem cells come from an umbilical cord.
Ooh.
From a lab. They extract them perfectly, so it's like
That's
pure
awesome.
stem cells. I like it better than filler because the risk for the vascular occlusion, you could go blind, but also it just feels more natural and it's not as puffy looking.
Yeah.
So I do like a little bit of that under here, and then I've got my lips done probably like 3 or 4 different times, but then dissolved in the middle. I kind of got overdone, and then right before my wedding I was like, I'm gonna restart. So I think I have like probably 0.7 milliliters right now, 0.6 if that. And then I have a little bit of chin. I have probably like 0.2 or 3. My boss was like, do you want to split it? I was like, sure.
Yeah,
We just had some left over, and I was like, yeah, pop it in.
Honestly valid.
I have like kind of like not a butt chin, but a line here.
I've been thinking about it because I do.
Yeah, but I kept it natural. I didn't want
Yeah.
a lot, so you can still kind of see it, but
Yeah.
yeah, I'm like,
Because
that's
then
what
I feel like it gets scary when people do bad chin filler and you can see it when
too
they
much.
smile.
Yeah. I just
That's,
wanted
like,
a little
evil.
bit and just to try it. And then for my as skin goes, like we'll do microneedling, and I do the CO2 laser, which is very, very intense. I've only done that once. It just basically burns off your skin to make new skin.
Yeah.
So I've done that once, and then microneedling. But I think that's it.
I get like hydrofacials.
I'm 23.
And, like, literally.
We're 23.
I'm only 25.
Yeah.
But like I do facials and stuff all the time.
Right.
I've been wanting to do microneedling, but now that it's about to be summer, I'm like, you're not supposed to be outside, and like
You probably
I
gotta
want to
do
do
it
it seriously. Yeah, so I think I'm gonna wait until
That's
fall.
what
and then
I
do
did.
it,
I did
but-
my major things, and I always do my major things in the fall.
Yeah.
No, it's
just
so
better
fun.
that
It's
way.
hard not to get a lot. Like genuinely, I had to redo my whole lips because I was so overfilled. And my boss was like, Hailee,
Girl, we gotta fix it.
And I'm so glad she said something because like I didn't know.
Yeah.
I had blindness.
Yeah,
And then
everyone does.
If I would have saw it on one of my own patients, I'd have been like, her
Girl.
lips are too much. you know? But
Did dissolve? Okay, I have never gotten anything dissolved.
the worst pain in my life.
Okay, that's what everyone says.
I
And,
told
the
Tyson, I said, I
bruising.
will let you know what hurts more, childbirth or dissolving.
Yeah.
It's not that the poke hurts, because the poke
Yeah.
feels the same as filler. It's the same syringes. The dissolvent burns so bad.
And that's such an awkward like
Yeah.
nerve. So many nerve endings.
There's so many nerve endings in your mouth. Like if you do
Did you get a block?
I didn't do the dental
Oh.
block. Usually it's like lidocaine in your canine teeth.
Like the dentist.
Yeah, like the dentist. And so I was like, I don't want to be numb the rest of the day. Like, let's just do numbing cream, and then I can tell my patients how bad it hurts.
And then you're like, I forgot that.
I do not dissolve anyone unless they will
Get a block.
Yeah, unless
Yeah.
they're like, I really am fine. They're covered in tattoos, because I'm like, I don't want you to feel how it was so bad. Like, I was sitting there like trying not to say the freaking swear words of every word I could in front of my
Yeah.
boss, but I was like,
As she's the one dissolving it, you're like,
she's like, I know, girl, and it burns so bad. I videoed it too, and I was just like, I
You're
can't
like,
even
that
post
can't even
that.
go anywhere.
I was like, I can't even post that. But honestly, the dissolver works really fast. Like by the end of the day, it was gone.
that's crazy.
You can't refill for another 2 weeks just in case. Like there's
Yeah.
some still doing work, because why would you refill if it's still gonna eat away?
Yeah.
But usually I'm like that 2.5 week. I was like right in her chair again. I was like,
You're like, I
get
am
me
ready.
full, get me filled.
I feel different. I know different.
I actually didn't mind my lips smaller, but I was just like, get it back
and, like,
in there.
It really dissolving, it's not that big of a deal. Yeah, it hurts like
Yeah.
no other, but you can always get more, or you can always get rid of it. Like it's not like a permanent, like when I think plastic surgery,
Right.
a lot of the plastic surgeries we do, like an abdominoplasty or your
Right.
arm, like if you do a lift of any kind, there's no turning back around.
No.
Where it's like boob patients, I'm like, girl, get the implants. I can take it out just as fast as I put it in. Like
No,
it's literally
really.
that big of an incision. It's not
Slide 'em in and
permanent.
out.
Who cares? Like you can get a lift one day if you need to.
Right.
Like that's not as big of a deal as like altering like nose job. No one's gonna, you can't go back in and fix that. Like,
No, like once it's done, it's done. But
Yeah.
with filler, luckily you can dissolve. And dissolving might take a couple rounds, but it does dissolve.
Yeah.
It is a lot though. It freaking
Have you
hurts.
dissolved it anywhere else on any of your patients besides lips?
Honestly, no, I don't think so. I've never.
Because I feel like no one like gets like
Chin.
under eye filler or cheek or like chin
Yeah.
and then it's like, oh, I don't like it. It's like it always
Yeah.
looks better.
And usually, like, if people have complications, then they go to their provider.
Yeah.
And I personally have never done any under eye filler. I've done a few noses, but then I just feel like it's too scary and I don't want the risk anymore. I'm like, it's not worth the money. I'll just do lips.
Yeah.
So really, honestly, no, I haven't had any. And then, granted, I've been a nurse for almost 2 years now. So, like, maybe I'll have some of my returning clients want to dissolve at some point. But dissolving's not meaning, like, I did anything wrong. It just means they might want to change.
Or restart.
Yeah.
Because, like, I have friends who've gotten their lips done since they were literally 18. And, like, we'll be like, oh, yeah, I just need to go in and, like, dissolve this lump or, like, dissolve this little bit.
And naturally, it can happen. It can migrate. And it is, I like to describe to my clients, like, maybe after 4 syringes of filler, dissolve it, because it's like putting new concrete on old concrete. If it's cracky and bumpy, adding a new layer is not going to really fix that.
It's just gonna
do the same thing. Yeah. So yeah, I usually recommend every like 4 syringes they start clean. Yeah. I'm like, let's dental block you up.
No, for real. When I got my first half a syringe, I got dental blocks. I had a great time. I didn't feel anything. And then I went to someone else afterwards. Not that the first girl didn't do a good job. It was just like a friend of a friend kind of thing. Right. And she was like, for super cheap. I'm like, okay, like she's so good. Like whatever.
We'll just do it.
I'll do it. Like I was splitting the syringe with my friend. And then we go in and she just numbed me. But I was talking as she like just numbed me. And it's like, I don't think it got up here enough. So when she started doing like my Cupid's bow, I was like, levitating off the chair. I was like single tear down my eye. I was like, I will if I do stuff in the future, which like, come on, be so for real. Yeah. I will be like, block me up, girl. I don't care. Like Botox is nothing, but that was like too much for me. So if I ever get dissolved, I'm gonna be like, intubate me.
I've done it with and without numbing, just because again, I'm like curious
to see what it's like.
I'm like, what does this actually feel like? But yeah, honestly, I tolerate really well. I just bruise very bad. Oh, really? My lips are purple. Like one time we touched up my lips, and then Tyson didn't tell me, of course, that we had a wedding reception that night for his teammate. I like literally am like this giant purple mark. He's like, it's fine, it's advertisement. I'm like, they're gonna think I'm looking crazy.
They're gonna think you bit me.
I like just put lipstick on. I was like, I guess we're going a dark brown lip, like, because I don't know what else to do.
I remember like lathering on arnica.
No, literally, like, arnica does help, and some people take the tablets. I've never done the tablets, but you can take.
I just found the gel, and I was like, honestly, I feel like it made such a difference the second time.
Yeah,
and then like toxic. I never like, you don't bruise the needles, like literally an insulin needle and like half a centimeter. Yeah. And that's not bad. That's why everyone's like, you inject yourself. I'm like, yeah, I think it's fun. You're like, because I want to know what it feels like. And I also trust myself and my knowledge.
True.
Like, I'm like, I know what I'm doing.
I know how I like my forehead. Yeah. My boss does a great job, obviously, but I'm like, I like to make my little, like, I like my 4 units, you know?
No, exactly.
And she's like, you only need 2. I'm like, no, I want 4.
I feel like that's such a nurse thing, a nurse reaction too, to be like, no, I'll do it myself.
No, I'll do it myself, and I want the most I can.
Don't worry about it. I'll be back.
It's free. I'm like,
no, literally.
That's the thing, is it is hard to say no, because it's out of your pocket of product. And it's like, it's so cheap.
Or if there's extra, and I'm like, okay, like, well, I already drew it up. It's already mixed, and you can only, once you mix Tox, you can only use it for a certain amount of days too.
Or even filler. If someone doesn't want all of it, like, I'll tell the front desk, I'm like, who wants a touch up?
Yeah, like, anyone touch up? Like, I have the tiniest bit, because it's like, you might as well use it versus losing it when it's so expensive.
Yeah, you're like, don't just throw it away.
Yeah,
I feel bad throwing away filler sometimes. I'm like, oh,
you're like, anyone like in the vicinity.
Sometimes I'll put the filler into smaller insulin syringes, and if I poke them, obviously then what's inside there, I'm like, how am I going to get it out? Yeah, because I can't switch out the needle. So then I just throw it away. I get sad. Like, I'm like, are you sure you don't want it? They're like, yeah, I'm good. I'm like, all right, fine by me, queen.
Yeah, but yeah, again, so different than the hospital.
So different than the hospital. Clock on that.
Our overarching theme of
today:
outpatient nurse girlies. You can be a girly girl and be a nurse.
You can have nails.
You can have nails. I don't know.
Fully have my acrylics on.
Yeah, exactly. It's not that deep. No, it's not that deep. This was so impromptu too. Like, thanks for saying yes and coming and doing this.
I texted you. I was like, we have to do this. Like,
no, we've been talking about it for so long.
No, and we have.
Yeah, and she came to visit for the weekend, so we're like, okay, let's set it up.
Because we could have done it like on a Zoom, but it's like,
no, that's not as fun. And we're in the hotel.
It's a whole different vibe together.
It is.
No, happy Nurses Week to all the nurses.
No matter what kind of nurse you are.
Yeah, whatever nurse you are,
still counts.
You keep going, queen and king.
Yes. Do you want to promote anything you're doing? Promote your pages. Say all your stuff. We'll put it in the description too, and tag all of the things. But
well, it's just, I'm like, I've never done this. Like, here's my plugs.
Yeah. No, for real.
My personal page, which I just like to share all the behind the scenes, is just Hailee_Shelley. And then my aesthetics page is Aesthetics by Hay. And I'm on TikTok and Instagram.
And we'll have it all in the caption below.
Yeah, I'm just around.
Yeah, I know.
So fun.
So fun. I always love getting to chat with the nurse girlies. I feel like it's such a niche and everyone has their own story and their own journey. And yeah, make sure subscribe, follow along.
Clock it.
Spotify, Apple. You know, we have the Instagram. We did just have our event with Boise Girls Club, Match Made in Heaven. You guys sold it out. It was actually insane. I want to say thank you. Like, that was so amazing. We worked with some amazing brands. Everyone had so much fun. I think we might start doing it like quarterly if everyone still loves. Aww. It was so much fun. So grateful. So look at the Insta, TikTok, all that good stuff for the recaps and more opportunities. We have an event every month now. So have an event. Announce the next one yet, but Drama. Nurses Week and Women's Health Month. So stay tuned because we got some
for the girls
planned. Always for the girls, you know, finding balance, creating it together. But yeah, I love you all and I'll see you next Wednesday.
See ya.